Hi, my literature review would be on health disparities in healthcare regarding the Black maternal mortality. The statement of problem is that health disparities have been in healthcare for many centuries, and minorities are the most affected. Black women are 3 to 4 more times likely to suffer from a severe complication during childbirth or death than a white woman. Throughout this literature review, I will talk about the underlying problems with health inequality. The subtopics I will touch base on will be poverty, education, and socioeconomic status. For poverty, I will talk more about whether pregnant Black women live in low income areas or if they live in a more wealthy environment. I will also talk about the lifestyle choices, whether if they smoke during pregnancy or if they are eating good. I will also talk about the emotional development / mental health, whether stress plays a factor in pregnancy or a mental illness. So there was research that found that explains how exposure to stress during pregnancy likely contributes to disparities in pregnancy health outcomes. The purpose of this article was to understand the types and magnitudes of stressors African American women are exposed to during pregnancy. I will also, like I previously said, one of my subtopics are education. And I will talk about the personal stories of women and their experience during the birthing process. In the article, the author goes into depth of how structural racism is deeply rooted in a historical system of oppression and how society and healthcare devalues women of color and how racism still presents itself in healthcare policies and practices. Furthermore, in education, I will talk about the lack of knowledge regarding healthcare, whether they have the proper knowledge of the neonatal care in pregnancy or the maternal care in pregnancy, as well as I will talk about the intersectionality of having low education and low income regarding Black women. And for the last subtopic, which is socioeconomic status, I will talk about whether if they have the great access to healthcare and if they can afford great healthcare. One of the articles. One of the articles, it determines the importance of socioeconomic factors that can contribute to getting healthcare. It also touched based on how Black women who are successful can still be at a high risk of experiencing health inequality and having a negative outcome throughout their pregnancy. And the gap I found was that some articles need to be more elaborate on why social determinants influence disparities within healthcare and how Black women are more prone to these advantages, whether they have like money or if they are poor, they can still be at risk of having a negative outcome in pregnancy.